Hello, my name is Hariz Hamizan. I'm from Group 26 and today I'm going to demonstrate on how to disconnect a urinary catheter. But first of all, we must assemble all the equipment. The equipment are disposable gloves, antiseptic wipes or alcohol swabs, in which I have, sterile caps and sterile plugs. But I don't have sterile plugs at the moment. Let's just imagine that there are sterile plugs. Now I have assembled all the equipment. The next step is to wash my hands and wear the disposable gloves. Now I have washed my hands and worn the disposable gloves. I can now proceed to disconnect the urinary catheter. But first and foremost, it is important for us to ask for the patient's permission before you do. Hello sir, do you mind if I remove the urinary catheter from you? Now we've gained the patient's permission, we can now proceed further. The first step for this is to clamp the drainage tube onto the bedside. But I don't have clamp, so next is to remove the drainage tube from the catheter. If in any chance an accidental contamination were to happen, take a sterile swab or an alcohol swab to disinfect both ends. Next, always hold the drainage tube and catheter upwards so that it doesn't touch any part of anywhere around the area to avoid any infection. So the next is to take a sterile plug and plug into the catheter, but I don't have it at the moment, so let's just imagine that the sterile plug is already inserted into the catheter. For the drainage tube, take the sterile cap and insert it into the drainage tube. Always hold at this part of the drainage tube and not this part, because it is dirty and may cause infections. Carefully insert it and place it into and station it onto the drainage tube to secure it. And that is how to disconnect a urinary catheter. And not to forget, always dispose your gloves after the procedure. Lastly, wash our hands again. And that is the end of the demonstration on how to disconnect a urinary catheter.